Hi, Dave with Align Therapy here. We're going to talk about muscle activation and Schroth exercises. Before we talk about this though, I want to stress the point that these exercises are not ones that I want you doing at home. Your curve is probably different than Melena's. Melena's our model today. Thanks for doing this, Melena. But I don't want you doing these at home because this is for a specific type of curve, especially with Melena. She has a right-sided thoracolumbar curve, which is not the regular curve that we usually see. So don't do this at home. This is to educate and show you how we do these corrections, but it's not an instructional video for you to do them at home. I can't stress that enough, but let's get to it. So what we're going to do today, since Melena has a thoracolumbar curve going to the right, we're going to try and activate the muscles on the left side of the spine to pull the spine to the left side. So a couple of things with this. We use a specific muscle called the psoas. The psoas muscle is a hip flexor muscle, and it comes up and it inserts onto the side of the spine. As we contract that, it can pull to the left. This side on Melena is called the concavity because it's the concave side of the curve. And we always contract the muscle on the concave side to pull it towards that side. We use the hip flexors because of how they insert into the spine. So Melena, go ahead and put your hands up on the bars. We're not going to go through full Schroth corrections with this, but I want you to see what happens when we contract the muscle in the concavity. So Melena's going to sit tall. She's going to push her elbows out to the sides. We're going to correct her pelvis. Good. We're going to elongate the spine. Elongation is very important in scoliosis correction. We're not shrugging the shoulders, we're pushing out, and we're trying to expand. So as she does this, we notice the difference between the left and the right side. We notice that this side is more concave, it's more in, this side is more out. So as we correct and we elongate, go ahead and push forward here, good, in just a hair, perfect. Bring that back a little, good. So we start to see that reduce a little bit. And as she breathes into that left side, very good. We see expansion happen in that concavity. So as she's elongating, then we can contract that hip flexor muscle, the psoas. Go ahead and push your knee up into the strap. A little harder. There. We start to see that fill up and expand outward. We see less tension on this muscle here. Keep breathing here, Melena. Good. And we see that fill up. That's the spine being pulled to the left. As long as she's maintaining elongation and as much correction as she can, that's fantastic. Don't relax anything other than the push with your knee, Melena. Go ahead and relax that back down. Sit down. We see that gradually just go back in, but she's still elongating. Now go ahead and relax all the way. Good. And we see that concavity return. So what we want to see is that as she uses those hip flexors and the psoas contracts, we want to see the spine move to the left. We want to see that the elongation stays and that we get some correction with that muscle activation. Again, this isn't something I want you doing at home. This is for demonstration on how we use muscle activation and what we should be seeing. So usually you won't feel that happening, but we can definitely see that happen as we do that correction. So if you're in Schroth training and we have you push up into a strap with your knee, or we have you lift your leg or push a pole down, those are all ways that we're trying to get that concavity to contract and expand and pull the spine in a more corrected position. It has to be done correctly, has to be done in the right order, but it is a great way to get correction, specifically in the lumbar and thoracolumbar spine. So thanks, Melena, for being my model with this, and hopefully you learned something and that it was helpful. Thanks.